Okay, good day, class, and thank you for attending our last lecture. So, this would be the last part of your module 11, and here we're going to tackle immunopathology and the basis of diseases. So, with that, let's begin. Now, an introduction class to this module or to this lesson is that take note that the immune system is vital for the survival because it protects us from infectious pathogens that are abound in our environment. Now, predictably, immune deficiencies would render individuals easy prey to infection, but the immune system itself is capable of causing tissue injury and disease. Examples of disorders caused by immune response would include allergies and reactions against an individual's own tissues and cells. To simplify this class, whenever there would be a reaction, or let's say there would be an antigen antibody reaction in our body, this can cause damage to our cells and tissues. And this damage class would manifest. Magmamanifest itong damage na to as some sort of allergy or reactions against our own tissues and cells. So take note, class, ha, in this part of the lesson, we're going to tackle how your allergies occur, how different reactions would cause tissue death and cell death, such as in the case of autoimmunity. And one of the most common effect, class, when it comes to cell death ng mga antigen-antibody reaction na to, if you're familiar, is your hemolysis or the destruction of your RBC. So let's continue. Now, let's go to different definitions of terms, class, for this lesson. So take note that the first word, your hypersensitivity, is defined as a normal but exaggerated or uncontrolled immune response. So this is a normal response, class, to an antigen. But in some cases, it becomes exaggerated or uncontrolled. And since it is uncontrolled, class, or exaggerated, it can cause inflammation, cell destruction, and even tissue injury. So let me repeat, kapag hypersensitivity, class, this is a normal reaction to an antigen. But the problem here is that it tends to become exaggerated or uncontrolled. And that could lead to damage in the form of inflammation, cell destruction, or tissue injury. Now, this is also defined as an enhanced immune reaction, heightened state of immune responsiveness. Now, another term you need to take note of is immunization or sensitization. Now, whenever you would hear, di ba tayo nung bata tayo, our parents would usually, or doctors would usually ask to our parents, Madam, yung anak nyo po ba is na-immunize na? So, here you will understand ano bang meaning ng immunization. Now, immunization, class, or sensitization would describe an immunologic reaction dependent on the host response to a subsequent exposure to an antigen. To simplify this, class, kapag sinabi mong immunization, this is basically exposing our body to an antigen. And it would describe the reaction after the exposure. So, kaya pag sinabi na na-immunize po ba yung anak nyo against measles, meaning, class, you were exposed to vaccines. So, kapag sinabing na-immunize ka na, you were basically exposed to vaccines. Kasi remember, ang vaccines nyo is the weakened form. Ito yung weakened form of a certain antigen, either bacteria or virus. So that's immunization. So you're basically exposing your body to an antigen and describing the reaction after. Now, another word here, class, is your allergy. This is originally meant as any altered reaction to external substance. Class, take note. Allergy. This is a reaction to external substances. Hindi lang, this is not specific only to antigens. but they could include class what we call certain allergens. And one of the most common allergens class is uh, yung mga flowers. They would tend to release pollen, and pollen in some people could cause an allergic reaction. Hay, it could be sneezing in the form of sneezing, etc. Then we also have another term here, your atopy. Atopy class would refer to an inherited tendency to respond to naturally occurring inhaled and ingested allergens with continued production of IgE. Now, the term allergy and atopy are now often used interchangeably, and atopic allergies would include hay fever, asthma, food allergies, and latex sensitivity. To simplify class ang difference ng allergy and atopy. Atopy class is technically a form of inherited allergy. So kapag meron kang atopic allergy, such as your asthma class is most of the time genetic na mamana, or it could also be acquired outside. But allergies class could either be acquired or inherited. But atopy, most of the time, they are technically inherited allergies. Kaya ginagamit sila interchangeably because of that. So they have the different definition. They are both a reaction to external substances, but atopy is more of the inherited type of allergy, such as your latex sensitivity, asthma, hay fever. But there's still a possibility class na itong mga to, they could be acquired. Except itong food allergies class. Most food allergies are genetic. Kasi if you ask yung kapatid mo, allergic sa crabs, yung nanay din niya pala allergic sa crabs, yung father niya allergic sa crabs, something like that. Now let's go to another word, your allergens. So allergens are antigens that trigger allergic reactions, and they are usually low molecular weight substances that could enter the body like being inhaled. So yung katulad ng pollen, eaten, an example would be crabs or shrimp, seafoods, and they could be administered as drugs. Kaya nga whenever there would be an injury, dadaling kayo sa hospital, i-ask ng doctor, are you allergic to any type of drug? Kung allergic ka ba sa penicillin, allergic ka ba sa isang certain antibiotic. So, those are allergens class. They trigger your allergy, and they could enter via being inhaled, eaten, or administered as drugs. Now, environmental substances class, take note of this. These are typically exogenous factors. When you say exogenous factors, they are found outside the body or in the environment. So from the word environmental, they are in the form of small molecules that could trigger a type of hypersensitivity reaction. The most common class is yung dust or yung alikabok, which could enter the respiratory tract, and thus they could mimic parasites and stimulate an antibody response, triggering a type 1 or immediate hypersensitivity reaction, such as rhinitis or asthma. Then we also have infectious agents. So not all infectious agents class are capable of causing hypersensitivity reaction. An example of this is your influenza virus, which would cause hypersensitivity, resulting in damage to the epithelial cell in the respiratory tract. And then there's the endless or walang kamatayang cytokine storm class. You're very familiar with this in the previous modules ng midterm. This is an exaggerated immune response, and one of the viruses capable of causing of this is yung COVID-19 yung class. COVID-19 could trigger high levels of cytokine secretion, leading to a cytokine storm. And kapag may cytokine storm ka class, this can lead to tissue damage, especially the blood vessels. And you could manage this class by the use of dexamethasone infusion for infusion. So yun. Simply dexamethasone infusion class. You could use that. And then there's the so-called self-antigens. So when you say self-antigens class, these are very small immune responses to self-antigens, which are normal and would occur in most people. So when this becomes exaggerated response, or when the tolerance to other antigens break down, hypersensitivity reactions could occur. So normally class ang self-antigens nyo are harmless. But whenever there would be an exaggerated response, or when the tolerance to other antigens break down, hypersensitivity reactions could occur. And then there's also your food allergies. So food allergies could cause severe allergic reaction and even death from food-induced anaphylaxis. Despite the risk, there is no current treatment for food allergies class. The disease can only be managed by allergen avoidance or treatment of symptoms. Now, this is based on a story, so magkwento lang ako. When it comes to food allergies class, I have a friend who was allergic to crabs. So what she did, ginawa niya is that she would eat small amounts of crabs every siguro twice a month, twice a month class. And she did this for 2 years. Then at first nagkaroon siya ng mga allergic reaction class. She developed wheals, yung WHEALS, yung parang what's the Tagalog term of this? Nagkaroon siya ng parang mga bumps sa skin. And then after that, after the second year, there was redness, there were wheals, and on the third year class, she noticed that it started fading or nawawala na. So what she did instead of doing it twice a month, she tried doing it once a week. And guess what, class? Once a week, there were no more wheels. Hindi na siya nagkaka-wheels. Hindi na siya nagkakaroon ng allergic reaction. But in very small amounts lang. When she tried eating a whole crab, medyo nahirapan siya huminga. She had difficulty in breathing. So she's still experimenting, class, on how she could develop tolerance to this type of hypersensitivity reaction. So if you want to try, this is not a professional advice, but if you want to try lang, class, those with food allergies, you could try eating very small amounts in a span of a certain time. Baka makadevelop kayo ng tolerance and you would be able to develop resistance against these food allergies. Now, let's go to the related reactions when it comes to allergic reactions, or allergies. They are known as your hypersensitivity reaction. Now, there are four types of hypersensitivity reaction. We have your type 1, type 2, type 3, and type 4. Now, let's tackle them one by one. Now, for every hypersensitivity reaction class, there is the basis or the type of reaction. For your type 1 class, it is usually anaphylactic. So when you say anaphylactic class, they would typically be found or they would develop in the skin, and they tend to form itchiness or bumps and wheals. So take note of that. Kapag type 1 class, they tend to be found in the skin. They could be itchy and there would be the development of wheals or bumps. While for your type 2, it is cytotoxic. The prefix cyto here meaning cell, and toxic, which would refer to death. So in type 2 reaction class, there is cell death. Take note of that. There is cell death or cell destruction. For type 3, there is an immune complex. When you say immune complex, there is an antigen antibody reaction involved. For your type 4, it is T cell dependent. So this would involve, class, the T cells, both T helper and your T cytotoxic. So your CD4 and your CD8 cells are involved. Now, what is the antibody involved in type 1? It's your IgE. So there are antibodies involved for every reaction. Type 1 is IgE. For type 2, it is IgG. So just remember, IgG class can cause cell death or cell destruction, and even other immunoglobulins. Then for type 3, there is the involvement of either IgG and IgM. And for type 4, there is no antibody involved. Now, for the complement involved class, only type 2 and type 3 are involved. So complement are involved in type 2 and type 3 because remember class, IgG and IgM could activate the classical pathway. Kaya involve yung complement siya. The cells involved for type 1 are mostly mast cells, basophils, histamine. For type 2, the cells involved are your effector cells, your PMN, or your neutrophils and your macrophages. For type 3, the cells involved are macrophages and your mast cells. For type 4, the antigen specific T cells. Then cytokines, all are involved or all would involve cytokines except your type 2. So type 2 is the one wherein cytokine is not involved. Then comparative description, antibody mediated. So it would involve IgE for type 1 class. Type 2 is antibody dependent, complement, or cell mediated. For type 3, immune complex mediated. For type 4, T cell mediated, and this is known as also as the delayed type. Then for mechanism of tissue injury, allergic and anaphylactic reaction for type 1. Type 2 targets cell lysis, cell mediated cytotoxicity. For type 3, immune complex deposition and inflammation. And type 4, inflammation, cellular infiltration. And examples of type 1 would include anaphylaxis, hay fever, asthma, allergy. For type 2, this would include your hemolytic transfusion reactions, HDN, and even thrombocytopenia. For type 3, it could include your Artus reaction, serum sickness, and your SLE. And for your type 4, it could include your allergy or infection and worst case, contact dermatitis. So I want you class to memorize this table. This will come out in your exam. Now let's tackle the first type of hypersensitivity class. The first one is also known as your type 1 hypersensitivity or immediate hypersensitivity. So the mechanism here is that it is a cell-bound antibody wherein it would react with antigen to release physiologically active substances. So reactions can range from life-threatening anaphylactic reactions to milder manifestation associated with food allergies. Now, the distinguishing feature of type 1 hypersensitivity is the short time lag, usually seconds to minutes between exposure to antigen and the onset of clinical symptoms. Kaya nga class, whenever you would have an allergic reaction to food, when you have food allergies class, there is usually a very short time from exposure to antigen and the onset of clinical symptoms. Let's say allergic ka sa shrimp. Kumain ka ng shrimp class agad-agad. The next few seconds, you would notice that you're starting to itch. Nangangati ka na, and worst case, you would have difficulty in breathing. So there's a very short time lag between the reaction of the exposure to antigen and the showing of symptoms. Usually seconds to minutes lang yan class. And the effector cells would include basophils and mast cells, which would contain numerous cytoplasmic granules and high affinity receptors for IgE. The key reactant present class is IgE. So, di ba earlier, this is a cell-bound antibody. So, here you would have your IgE class. Your IgE in this case is usually attached to a basophil. Now, when your antigen class would attack or would attach to the IgE, this will cause your IgE class to cause the activation or the release of certain granules from the basophil. Magre-release yan ng histamine, magre-release yan ng mga active substances that could lead to a reaction. So, ulitin ko ha. IgE is attached to your basophil, and when your antigen encounters the IgE or attaches to the IgE, this will cause the basophil to release substances from its granules. And that could lead to this type of reaction. So this is what happens, class. Ayan. This is a better explanation of what I mentioned earlier. So this is what would happen on first exposure to an allergen. T helper 2 cells will secrete cytokines such as your interleukin 4 to stimulate IgE production against the allergen. So when your body encounters an allergen, class T helper 2 will secrete a cytokine, si interleukin 4. Si interleukin 4 magkukos ng secretion ng IgE. Si IgE class would attach to the high affinity Fc receptor. So ito yung IgE nyo. This is your IgE. Upon being produced class, it would now attach to the basophils or mast cells. So in this case, there is no activation of the granules. Now once it is already attached class to the basophil, IgE will now serve as an antigen receptor on basophils and mast cells. And upon re-exposure, allergens can link the Fab regions of the IgE molecule, and this would cross-linking or bridging would trigger the release of mediators from basophil and mast. So yun siya, class. This is a better explanation. So tandaan nyo lang, your IgE would attach to the basophil mast cell, and then after attachment, the antigen will attach to the Fab site of the IgE, and this would trigger class the release of the substances from the granules, or in other words, degranulation would occur. In short, class antigens complex with IgE and attached to basophils or tissue mast cells, which would result in the release of histamine and the synthesis of leukotrienes and prostaglandins. Although type 1 reactions can be systemic, most of the time, class, they are localized. Examples of this are your food allergy, anaphylactic shocks, and asthma. Now, upon exposure of allergen, the substances of your octalbumin of egg and seafood proteins, dendritic cells would recognize and label it as foreign and would undergo phagocytosis. So when your body detects allergens class, yung mga dendritic cells nyo, and they would phagocytosis, they would phagocytize it. And it would protrude in the cell membrane to be present in the lymphocyte, specifically T helper 2. So ito yung sinasabi niya kanina earlier class, na when your allergen is presented to T helper 2 cells, si T helpers 2 nyo would secrete interleukin 4. And si interleukin 4 nyo would cause the secretion of IgE. And also dendritic cell will be present in B cells to undergo differentiation and eventually undergo antibody class switching. So from IgM, it would become an IgE, and IgE will bind to the mast cell and start degranulation. Mast cells will release histamine, a potent inflammatory mediator, causing vasodilation, which in response would cause increased blood flow, production of rashes. Kaya nga, class, di ba, ang rashes nyo, they tend to be red, and the reason for that is because there is vasodilation from your histamine due to the increased blood flow. So these are the different mediators of anaphylaxis class. So histamine would increase vascular permeability, promote construction of smooth muscle. Leukotrienes would alter bronchial smooth muscle and enhance effect of histamine on target organ. Basophil kallikrein would generate kinins. Serotonin would contract smooth muscle. Platelet activating factor enhances the release of histamine and serotonin from platelets that would affect smooth muscle tone and vascular permeability. Then for eosinophil, chemotactic factors of anaphylaxis, they would attract eosinophils to area of activity, and these cells would release secondary mediators that may limit the effects of primary mediators. Then we have your prostaglandins, which would affect smooth muscle tone and vascular permeability. So again, kindly memorize this table class. They may come out in your exam. So histamine, leukotriene, C4, interleukin 4, and interleukin 13 class, take note, are the major mediators of allergy and asthma. All of this four class, yung histamine, leukotriene, C4, interleukin 4, and 13, are released from basophils after stimulation with interleukin 3. Interleukin 3's effect is restricted to basophil granulocytes. Basophil granulocytes should be considered as key effector cells in type 2 helper cells and allergic inflammation. Interleukin 3 strongly induces messenger ribonucleic acid for granzyme B, which is a major effector of granule mediated cytotoxicity. Let's go to your anaphylaxis. So, what's anaphylaxis? Anaphylaxis class. This is a severe allergic reaction to venom, food, or medication. Most cases of anaphylaxis class are caused by a bee sting or eating foods that are known to cause allergies, such as peanuts or tree nuts. Now, anaphylatoxins or complement peptides are fragments that are produced as part of the activation of the complement system. And there's an event known as your anaphylactic shock, which is a rare but severe allergic reaction that can be deadly if you don't treat it right away. It is most often caused by an allergy to food, insect bites, or certain medication. A shot of a drug called your epinephrine is needed immediately, and you should call 911 for emergency medical help. So these are in an anaphylaxis class. There are three related reactions. So let's start with the anaphylactic reaction. So the first disease reaction is usually mediated by IgE antibody and would occur in three stages. The offending antigen attaches to the IgE antibody, fixed on the surface of the mast cell and basophil. Cross-linking of two IgE molecules is necessary to initiate mediator release from mast cell. Activated mast cells and basophils would release various mediators such as your histamine and prostaglandin. The effects of mediator release would produce vascular changes and activation of platelets, eosinophil, neutrophil, and the coagulation cascade. Then we also have your anaphylactoid. Now, when it comes to your anaphylactoid class, this is a false anaphylactic reaction. Bakit false siya class? This is an anaphylactic or anaphylaxis-like reaction. They are clinically similar to anaphylaxis and can result from immunologically inert materials that would activate serum and tissue protease and the alternate pathway of the complement system. Offending substances would act directly on the mast cells, causing release of mediators on the tissue such as anaphylatoxins of the complement cascade. So sa anaphylactoid reaction class, there is no IgE involvement. Sa anaphylactic, di ba may IgE? Dito sa anaphylactoid, there is no IgE. And this would involve only serum and tissue protease class, as well as the alternate or the alternative pathway of the complement system. So take note of that. Then we have your atopic reaction. Exposure of the skin, nose, or airway to an allergen produces allergen-specific IgG antibodies. In response to the allergen, the T cells would exhibit moderate proliferation and production of interferon gamma by T helper 1 cells. In comparison, individuals with atopy have an exaggerated response characterized by the production of allergen-specific IgE antibodies and positive reaction to extracts of common airborne allergens when tested with a skin prick test. So this is the pathway class leading to the chronic allergic reaction. It's similar lang din with what was explained earlier, but sige, let me explain it again. So when your IgE class, so na-secrete na yung IgE nyo, IgM has already become an IgE. Si IgE nyo would now attach to your mast cells. Now, mast cells class, when this is attached to the IgE, when the IgE is already exposed to an allergen, This would cause the secretion of different substances, such as your histamine, leukotrienes, platelet activating factor. And this would cause acute allergic reaction, such as wheezing, urticaria, sneezing, and rhinorrhea, conjunctivitis. Now, another effect is that this would also cause the secretion of interleukin 5. So, interleukin 5 class would cause eosinophil to secrete basic proteins, leukotrienes, and platelet activating factor. And this could also further cause chronic allergic reaction. So, there would be wheezing, blockage of the nose, and worst case, eczema. It could also cause the secretion of interleukin 4. Interleukin 4 class will cause your B cell to cause the secretion of to become a plasma, an IgE plasma cell, which would produce IgE antibodies. Then the allergens would also be processed class by dendritic cells, and the dendritic cells would phagocytize the allergens, and it would be presented to the T helper 2. And T helper 2 again would present this to the mast cell, causing chronic allergic reactions. So this is the diagram class of what was explained in the previous slide. So try to memorize this. This may come out in the exam. Now, acute allergic reactions class are caused by the antigen-induced release of histamine and lipid mediators from mast cell. In the skin and upper airways, basophils may also participate in allergic tissue reaction. Chronic allergic reactions, including the late phase reaction, may depend on a combination of pathway, including the recruitment of eosinophil, liberation of mast cell products by histamine releasing factor, and neurogenic inflammation involving neurotropins and neuropeptides. T helper 2 or T helper cell type 2, MHC, a major histocompatibility complex. So we're done with your type 1. Now let's go to the type 2 hypersensitivity class. Now when it comes to your type 2, the thing you need to remember here is that this is cytotoxic hypersensitivity. And it's also antibody dependent cell mediated cytotoxicity. Mechanism class is that your free antibody would react with antigen associated with cell surface. So, pinaka-best example for this is yung red blood cell nyo. Diba sa red blood cell nyo, class, for you to be able to identify their blood type, there would be certain antigens on the surface. And these antigens, if you still remember yung mga L-fucosyl, yung mga ganon, those different sugars, I forget the ano na yung iba yung sa blood type A sa blood type B. Naalala ko na lang yung L-fucose, which was the sugar that would encode for ganitong antigen. Anyways, so on the surface of certain RBCs, there would be antigens. And these antigens class would be attacked by the free antibodies. So the antibodies here would attack antigens on cell surface. And the most common example of the cell involved here are RBCs. Now, these antigens may be altered self-antigens or heteroantigens. Antibody would coat cellular surfaces and would promote phagocytosis by both opsonization and activation of the complement cascade. Key reactants here are IgG and IgM. Now, what happens here? So, antigens which may be altered self-antigens or heteroantigens found on cell surface would trigger IgG and IgM production. Antibodies would coat the cellular surface and would promote phagocytosis by both opsonization and activation of the complement cascade. So your macrophages, neutrophils, and eosinophils would have Fc receptors that would bind to the Fc region of the antibody on the target cell, thus enhancing phagocytosis. Natural killer cells would also have Fc receptors, and if this linked to cellular antigens, cytotoxicity would result. If the complement cascade is activated, complement can trigger cellular destruction in two ways: by coating cells with C3b, thus facilitating phagocytosis through interaction with specific receptors on phagocytic cell, or by complement generated lysis if the cascade goes to completion. Hence, complement would play a role in the cellular damage that typifies type 2 reaction. So dito class sa type 2, if you remember sa type 1, di ba sa type 1, it involves mast cells and your IgE. Dito naman sa type 2 class, it would involve the effector cells. Yung macrophages nyo, yung neutrophil nyo, and even eosinophils or and even NK cell. So same principle in class, meron siyang Fc receptors dito. And the antibodies here would attach on the different cells. So pwede mag-attach sa macrophage, neutrophil, and enhance this would enhance the phagocytosis and can even lead to complement cascade activation. So dun masisira yung cell. So this is the better explanation again. In short class, complement fixing IgG or IgM antibodies are directed against cellular or tissue antigens such as those found on the surface of white blood cell and platelets. Examples of type 2 reaction class would include transfusion reactions, autoimmune hemolytic anemia, hemolytic disease of the newborn, ITP or immune thrombocytopenic purpura, some drug allergies, good pasture syndrome, organ-specific autoimmune disease such as your Hashimoto's and your myasthenia gravis. So here you would have your target cells class. And here's the cytotoxic cell. Now the cytotoxic cell class would have different antibodies attached to it. So this could be a neutrophil or a macrophage. So ito yung antibodies niya. And the antibodies here would attach to the surface cell antigen. And when that happens, class, remember this is a type of IgG or IgM. It would now cause the activation of your complement pathway, leading to cell lysis. So, So type 2 reactions involving tissue antigen, we have your good pasture syndrome, which would involve antiglomerular basement membrane, which is an antibody against collagen type 4. Hashimoto's thyroiditis, which would involve anti-TPO and anti-thyroglobulin. Then we have your myasthenia gravis, which would involve anti-acetylcholine receptor. And we have your insulin-dependent diabetes mellitus, which would involve islet cell antibodies, insulin autoantibodies, antibodies against glutamic acid decarboxylase 65 or your anti-GAD 65. Then we have a prototype. So one of the most common prototype or example of type 2 is yung mga transfusion reactions class. Now, if a patient is given blood for which antibodies are already present, a transfusion reaction would occur. So kung ikaw, class, you are your blood type A and you were given blood type B, di ba? Remember, si blood type A meron siyang anti-B antibody. Tapos si blood type B may B antigen, yun yung dinonate sa'yo. Yung anti-B antibody mo, since blood type A ka, yung anti-B antibody mo will attack the B antigen from donor blood. And when that happens, class, this can cause acute massive intravascular hemolysis to an undetected decrease in red blood cell survival. The extent of the reaction would depend on the following factors: the temperature at which the antibody is most reactive. So, ang pinaka-active na antibody class when it comes to transfusion reaction is your IgG. They are your warm antibodies. They survive in warm temperatures, 35 to 37. The plasma concentration of the antibody, so gaano siya kadami sa plasma mo or gaano kadami siya sa circulation mo. Remember, ang plasma mo, di ba, that is your liquid portion of the blood in the body. The particular immunoglobulin class. So dalawa lang naman ang pinaka-effective when it comes to type 2 reactions, especially transfusion reaction, is either IgG and IgM. And IgG is the one that is more deadly. Then the extent of complement activation. Then the density of the antigen on the red blood cell and the number of red blood cells transfused. So these are the basis class kung gaano kalala or gaano kahaba or extent ng reaction or how worse the reaction could occur. The temperature at which the antibody is most active, yung plasma concentration, gaano kadami sa circulation natin, the class, the extent of the complement activation, the density of the antigen on the red blood cell, and the number of red blood cells transfused. It is important to detect antibodies that would react at 37 degrees class because if a reaction would occur only below 30 degrees, it can be disregarded because such antigen antibody complexes would tend to dissociate at 37 degrees centigrade. Then there's the so-called acute hemolytic transfusion reaction. This may occur within minutes or hours after receipt of incompatible blood. Reactions that begin immediately are most often associated with ABO blood group incompatibilities, and antibodies are of the IgM class. Then there's the delayed hemolytic reaction. This would occur within the first 2 weeks class following a transfusion and are caused by a secondary response to the antigen, which the patient has been previously been exposed. The type of antibody responsible class is IgG. Then we have also your HDN or your hemolytic disease of the newborn. So they would typically appear in infants whose mothers have been exposed to blood group antigens on the baby cells that would differ from their own. The mother would make IgG antibodies in response, and this would cross the placenta to destroy fetal RBC. Severe HDN is called erythroblastosis fetalis, and the most common antigen involved in severe reaction is the big D antigen. You treat this by using ROGAM class, ROGAM at 26 to 28 weeks and within 72 hours after delivery. So this will be further discussed in your immunohema. So this is how HDN would occur class. So here you would have an Rh positive father and an Rh negative mother. Now during the pregnancy, the baby is Rh positive. So kunwari yung baby naging Rh positive. Now if the baby is Rh positive and the mother is Rh negative, at delivery, during the time of delivery of the baby, Rh positive baby's blood cells would enter the mother's bloodstream. This would cause the body to treat it as invading or as foreign blood cells. And since it is foreign class or hindi niya ma-detect as its own, it would be considered as an antigen. And again, if there's an antigen, it would lead to the production of anti-Rh antibodies. Months later, Rh antibodies would remain in the mother's bloodstream. That's why on the second pregnancy, on the second baby's pregnancy, if the baby is again Rh positive, the Rh antibodies present on the mother's bloodstream class will attack the baby's blood cell, causing your HDN. So that's a simplified version of your hemolytic disease of the newborn. Okay, class. So this time, let's continue with your type 3 hypersensitivity. So your type 3 hypersensitivity class is basically an immune complex hypersensitivity. Now, when you say immune complex, this would involve antigen and an antibody reaction. Now, the mechanism of this hypersensitivity class is that the antibody would react with soluble antigen to form complexes that would precipitate in the tissues. The key reactants here are your IgG and your IgM. IgG or IgM is involved in the destruction and is complement mediated. Remember IgG and IgM class, these two can activate, it can activate your complement. Now, when soluble antigen combines with antibody, complexes are formed that precipitate out of the serum. If it was taught to you in your laboratory class, immunosero lab, whenever we would talk about soluble antigens, these are the ones that would be visible via precipitation. There's even agglutination, but we'll not tackle on agglutination. We'll tackle more on precipitation. Now, what happens in precipitation class is that the soluble antigens would attach to antibodies. Now, since they are very small, soluble sila class they are very small, they tend to precipitate or they would precipitate out of the serum. Lalabas sila sa serum class. And this would go to the tissues. Now in cases wherein there is too much complexes, too much soluble antigen antibody complexes, this would be normally cleared by phagocytic cells. But if there is too much, sobrang dami, to the point that the immune system would be overwhelmed, these complexes would start going into the tissues. So let me repeat, class. In this type of high hypersensitivity reaction, this would involve precipitation, and that would usually involve soluble antigens and an antibody reaction. Now, normally, if this interaction would occur, they would just be removed via phagocytosis. But in cases if there's too much complexes, they would cause the immune system to be overwhelmed and they would start being deposited into tissues. There, they would bind complement class, causing damage to the particular tissue. And this is characterized further by deposition of antigen antibody complexes, influenced by the relative concentration of both components. So I hope that was clear. Now, here's what happens in your type 3 hypersensitivity. So the first thing that would happen, class, is that your soluble antigen combines with antibody to form immune complexes that would precipitate out of the serum. So here's the green one. Itong nakikita nyong green dito, these are your soluble antigens. Now, the soluble antigens class would bind with your antibodies. And when that happens, they would be normally cleared by phagocytic cells. But if there's too much class, sobrang dami nila, they would start being deposited into the tissues. Now, once they're in the tissues, it would cause your complement to be activated. So, mag-activate yung sa C3b and so on. And this would cause different effects, such as the release of mediators that would increase vasodilation, vasopermeability, attracting macrophages. Di ba pag vasopermeability class, it would call different WBCs to the site of injury. So, the dami yung macrophages, the dami yung neutrophils. And this would enhance the binding of phagocytic cells by means of C3b deposited into the tissues, leading to massive tissue destruction. Now, an example of a type 3 reaction, di ba, remember they are deposited in the tissues. An example of one of the most common type 3 reaction is yung tinatawag nating Artus reaction. Now, Artus reaction is known as your type 3 local reaction. This involves a local injection of the antigen, causes immune complex formation, and would lead to acute inflammatory hemorrhagic reaction and local dermal vasculitis. To simplify this, class, you would be injected with the antigen on the skin, and then that would cause an immune reaction. So yung in-inject na antigen na yun would cause your antibody to attack it. And this can affect, class, this would cause an effect on the skin. The effect on the skin is that it would cause an inflammatory hemorrhagic reaction and a dermal vasculitis. So there would be damage, there would be visible damage to the skin. Now, this is characterized, class, by erythema and edema. So redness, there would be redness and there would be swelling. So namumula, namamaga, and they would peak within 3 to 8 hours and is followed by a hemorrhagic necrotic lesion. When you say necrotic lesion, class, the tissue is dying or there is a wound that is starting to die. And this may cause to ulcerate. Now, this is caused by antigen-antibody combination and subsequent formation of immune complexes that are deposited in small dermal blood vessels. So if you take a look, class, the one affected here is your skin tissues. Your skin tissues are dying, your skin tissues are being destroyed by this reaction, wherein the soluble antigen attached to the antibody would start destroying the small blood vessels. This is due to the fact that there is the complement activation, which should attract neutrophils and causing even aggregation of platelets. So that's your Artus reaction. Simply explain, class, wherein you would be injected with a soluble antigen characterized by erythema and edema. So this is your Artus reaction, class. So here you would notice redness and you would notice edema or the swelling. So here you have erythema or the redness and swelling edema. Well, if you compare it with your type 1 hypersensitivity, which I mentioned earlier in the first few slides, yung wheel, yung mga tinatawag kong bumps, there would be no erythema and there would only be a local swelling. Hindi siya, basically no edema, class. So the entire part of the body is not swollen. Only a wheal or a flare would be red. So please take note of the difference between a type 3 artus and a type 1 wheel and flare reaction. Then we have another type of type 3 reaction, the so-called serum sickness. So if you compare this with the artus reaction, your artus is typically localized. So when you say localized, it would only affect one part of the body. But in your serum sickness, this would involve a type 3 generalized. So when you say generalized, it would involve the entire body. Simple as that. Now, serum sickness would result from passive immunization, class. So please take note of this. Passive immunization with animal serum, usually horse or bovine, used to treat such infections as diphtheria, tetanus, and even gangrene. Vaccines and bee stings may also trigger this type of reaction. So take note of this, class. In your serum sickness, this would be caused by passive immunization from animal serum. So when your body is introduced with substances that contain animal serum, this type of reaction would occur, such as those with vaccines and bee stings. Vaccines for diphtheria, tetanus, and gangrene. Now, in this disease class, the sensitizing and the shocking dose of antigen are one and the same because antibodies develop while antigen is still present. High levels of antibody would form immune complexes that would deposit in the tissue. Usually, this is benign and self-limiting disease, but previous exposure to animal serum can cause cardiovascular collapse on re-exposure. So take note of this, class. On the possible second time na ma-expose ka to this type of reaction, it could cause cardiac death or cardiovascular collapse. And another one involved in type 3 are your autoimmune diseases. So type 3 hypersensitivity reactions can be triggered by either autologous or heterologous antigen. So autologous simplified are self, while heterologous is same species. So antigens from the same species. So antigens basically from another person. Several of the autoimmune diseases fall into this category. Now, an example of disease involved in type 3 is your SLE, si lupus, and even RA. In SLE class, autoantibodies are directed against constituents such as DNA. Remember, if naalala nyo in the previous module, module 10, most of the antibodies in SLE would target DNA class or parts of DNA and even nucleohistones, which are found in most cells of the body. Immune complex deposition would involve multiple organs, but the main damage would occur to the glomerular basement membrane in the kidney. Then the last type of hypersensitivity class is your type 4 hypersensitivity. So your type 4 hypersensitivity class is known as your delayed hypersensitivity. So if your type 1 class is immediate, which would occur in an acute case, your delayed hypersensitivity would usually occur after 24 to 48 hours after contact with the antigen. So the mechanism involved here is that sensitized T cells would take place. So this one class is T cells. So instead of having B cells and plasma cells and antibodies, in this type of reaction, the one that is most active, the cell most active are your T cells. The key reactants here are your CD4 positive T cells, usually the T helper 1 cells. So, di ba, pag CD4 positive, we're talking about here the T helper. And to be specific, they're T helper 1. Now, antibody and complement are not directly involved class. There is an initial sensitization phase of 1 to 2 weeks. So, there are no complement. There is no antibody involvement. And sensitization class, when you say sensitization, the contact with the antibody would usually occur 1 to 2 weeks after the first contact with the antigen. Then, upon subsequent exposure to the antigen, symptoms would typically take several hours to develop and would reach a peak at 48 to 72 hours after exposure to an antigen. So take note of that. Initial sensitization would take 1 to 2 weeks. No antibody, no complement involvement. And upon re-exposure or subsequent exposure class, uh, it would take several hours to develop and would reach a peak 48 to 72 hours after exposure to antigen. So take note of that. Now, what happens in your type 4? Take note of this. So there would be an initial sensitization of phase of 1 to 2 weeks that would take place after the first contact of antigen. Then, upon subsequent exposure to antigen, symptoms would take several hours to develop and would reach a peak 48 to 72 hours after exposure to antigen. Now, Langerhans cells in the skin and macrophages in the tissue would capture and present antigen to T helper 1 cells. T helper 1 cells are activated and releases cytokines, especially interleukin 3, interferon gamma, tumor necrosis factor beta, and tumor necrosis factor alpha. This would cause edema, fibrin deposition, and generally enhance an inflammatory response. Cytotoxic T cells are also recruited and they bind with antigen coated target cells to cause tissue destruction. Now, in short, class CD4 positive T cells would react with the foreign antigen, releasing lymphokines, some of which are chemoattractants, and would release substances which mediate inflammation. The reaction cannot be transferred from one animal to another by means of serum, only the transfer of lymphocytes. Examples is your granulomatous disease, such as your TB and your fungal, tuberculin skin reaction, transplant rejection, and even contact dermatitis. So, one of the most common example of type 4 hypersensitivity class is your contact dermatitis. So, in contact dermatitis, this would usually be caused by low molecular weight compounds that would touch the skin. The most common cause would include poison ivy, poison oak, and poison sumac, all of which would give off uracil in the plant sap and on the leaves. So uracil class would cause the Langerhans cells, which is your skin macrophage, and it would function as the antigen presenting cell at the site of antigen contact. It appears class that Langerhans cells may migrate to regional lymph nodes and would generate sensitized T helper 1 cells there. So from the exposure class, let's say na-expose ka sa poison ivy. Your poison ivy, upon exposure to the skin, would cause your Langerhans cells to present to become an antigen presenting cell. Pag naging APC siya, basically phagocytize niyo yung antigen. Naalala niyo, di ba, for a cell to become an APC, dapat ipa-phagocytize niya. So, na-phagocytize niyo yung uracil dun sa plant sap. And once they become an APC, itong Langerhans cells, they would go to the lymph nodes. In the lymph nodes, they would present it to T helper 1 cells. And that would cause your reaction. So these are the effects of contact dermatitis. So there would be extreme positive, characterized by coalescing vesicles and a bulla, and a strong positive characterized by erythema, papules, infiltration, discrete vesicles. Then for a weak positive, there would be erythema, infiltration, discrete papules. And if you're doubtful, there would be faint or homogeneous erythema, no infiltration. Irritant, discrete, patchy, or homogeneous erythema, no infiltration. Then another type involved here in type 4 is yung tuberculin type hypersensitivity. So for tuberculin type class, this is the one you would use for, this is the one known as your skin test. The one that is commonly done for TB, and it is also known as your manto test. So testing for the exposure of tuberculosis is an example of a classic example of delayed hypersensitivity reaction. Kasi class, pag tinest ka ng skin test or manto test, you have to go back the next day. That's why it's the most classic example. You have to wait certain hours for a reaction to occur. So this is based on the principle that soluble antigens from Mycobacterium tuberculosis would induce a reaction in people who have or have had tuberculosis. Technically, class, hindi mo kailangan, you do not need to have or have had. It doesn't mean that you technically have TB for this. Even a possible exposure, kahit ma-expose ka lang, may katabi kang inubuhan ka na may TB, you could become positive for this test. So let me repeat ha, it technically does not mean, class, if you become positive for this test, that you have TB or have had TB. Even a possible exposure, kahit negative ka sa x-ray, clear ka, you were exposed to a person with TB, meron kang kasama sa bahay na positive sa TB, you could become positive for this test. But that is a case of a false positive result, class. Now, when challenged with an antigen intradermally, previously synthesized individuals would develop an area of erythema and induration at the injection site. The reaction reaches a peak by 72 hours after exposure. So this was a board exam question. Take note of that, class. So pag tinanong what is the peak hour for your tuberculin type hypersensitivity, the answer would be 72 hours. Okay, skin testing. So you have your tuberculin tests. So in tuberculin test class, the antigens used are your old tuberculin and your purified protein derivative. For older antigens, you would use old filtrate, bacillary emulsion, tuberculum residuum, synthetic old tuberculin trichloroacetic precipitate. So Manto test would be intradermal. Tin method is the disposable kit. Cock is subcutaneous. Volmer is patch. Von percutaneous. Moro is percutaneous. So all of these class are variations of your skin test. So ang pinaka-familiar tayo dito sa Philippines is yung Manto. I'm not familiar with the rest, but do memorize them, class. So for the tuberculin skin test, we have a dose of 5 TU or 0.1 ml. If a person is suspected of extreme hypersensitivity, start with 1 TU. More concentrated material, 250 TU administered only if the reaction to 5 TU is negative. So you would move, class, from 250 to from 5 TU. If it is negative, you would move the dosage to 250 TU. Now, when a tuberculin skin test is positive, if it's 5 millimeter class, so yung wheal or yung bump would have a size of 5 millimeter, the patient is HIV. So infected patients, close contact of active cases. So this is what I was saying, class. If you have someone in your home with positive for TB, persons with fibrotic chest X-ray film. Then if the size is 10 millimeters, these are people with factors that increases the risk of TB. So yung may mga diabetes mellitus and those that are immunocompromised. Then foreign-born persons from high-risk area, medically underserved low-income population, injection drug users, and residents of long-term facilities. Then if the size is greater than 15 millimeter, persons with no additional risk factor. So, so this is the summary again, class. Kindly take a note of this na lang. I will not longer explain them because but I want you to take note of the example. So if it's type 1, urticaria, hay fever, bronchial asthma, food allergy. If it's type 2, hemolytic transfusion reaction, uh, hemolytic disease of the newborn, idiopathic thrombocytopenic purpura, and some drug allergies. If it's type 3, immune glomerulonephritis, serum sickness, and arthus reaction. If it's type 4, tuberculin skin test, and contact dermatitis. So do memorize this table as well. This may come out in your exam. Now let's go to some of the autoimmune diseases, class. So conditions in which damaged organs or tissues would result from the presence of autoantibody or autoreactive cells. Now si Paul Ehrlich, class, one of the contributors for autoimmune disease, described this phenomenon as horror autotoxicus, literally fear of self poisoning. So in a normal immune response kasi, class, an invader like a virus would enter the body and immune cells would called lymphocyte create antibodies to fight the invader. So that's the normal immune response. So when an antigen enters the body would produce cells or would release substances to kill the antigen. But in an autoimmune disease, class, immune system creates antibodies that basically attack your own cells. Kaya nga tinaterm niya na self-poisoning. So a foreign substance resembling bodily substance enters the body. Normal body cells would become altered and lymphocytes malfunction and would make abnormal antibodies. Now, during the maturation process of T cells, the great majority of undifferentiated lymphocytes that are processed through the thymus do not survive. It is thought that this is where potentially self-reactive T cells clones are destroyed, known as the selection method. Naalala niyo yung tinatawag nating central tolerance, class, and your peripheral tolerance. Diba sa central tolerance sa peripheral tolerance, they are very important in autoimmune diseases because their purpose is to kill a majority of self-reactive cells or T cells, and this would allow for to avoid autoimmune disease. So the same process happens with B cells as they mature in the bone marrow. This destruction of potentially self-reactive lymphocytes is referred to as the central tolerance. Now, in the secondary lymphoid organs, peripheral tolerance is maintained by a delicate balance between T helper cell type 1 and type 2 population. Major histocompatibility complex products also seem to influence antigen recognition or non-recognition by determining the type of peptides that can be presented to the T cells. There's the so-called molecular mimicry, class. Now, when you say molecular mimicry, this refers to the fact that many individual viral or bacterial agents contains antigens, class, that closely resemble self-antigens. Now, for you to understand this better, whenever you would hear the word mimicry, class, mimicry would basically refer to copying or to copy. So you would copy. So ang nangyayari sa molecular mimicry. Let's say that there is an antigen. A certain antigen or virus would enter the body. So it would enter the body class. And upon entering the body, it would copy or it would have similar traits or characteristics with a normal cell. Now, what happens here is that when this antigen that has similar traits or characteristics with a normal cell, this will cause your antibody to start attacking the cells with a similar trait. So basically, class, if we make another example, let's say two twins, kambal, magkakambal, twins. Si twin A is a drug addict. Kunwari lang, drug addict si twin A. Si twin B, uh, let's say, very studious. Very studious si twin A. Si twin B. Now, what happens is when twin A class, pareho sila ng appearance, magkakambal sila. There is a possibility that twin B could be mistaken for twin A. So that's your molecular mimicry. Basically, your body identifies normal cell as an antigen due to the exposure to certain antigens that have similar characteristics with a normal cell. So let me repeat, class. Molecular mimicry refers to the action wherein when an antigen enters the body that has similar traits with a normal cell, it would trigger an immune response that would attack cells or normal cells that have the same traits or characteristics with the antigen that caused that immune response. So I hope that was clear. So a prototype here is a post-sequelae of acute pharyngitis secondary to Streptococcus pyogenes infection. And another one here is your rheumatic heart disease wherein your antibody destroys collagen in mitral valves. So this is your molecular mimicry. So your infectious agent, so ito yung sinasabi ko kanina. Your infectious agent or your antigen enters the body and they would have peptides or certain parts that are similar with your own cells. So this would cause your own cells to be attacked by these immune cells, causing an immune reaction. Then there's the so-called bystander activation. So similarly in class, infectious agent presented by APC, activation of non-specific antigen of non-specific activation. This is a bystander autoreactive T cell. Then let's talk about your lupus class. So systemic lupus erythematosus simply represents the prototype of human autoimmune disease. So siya yung pinakauna or pinaka-commonly discovered autoimmune disease. It is a chronic systemic inflammatory disease marked by alternating exacerbations and remissions. So these are typically, this could be inherited class or it could be genetic. So these are the different genes affected. Then it could also be environment. I had a student last year, Immunosero din class. She had lupus and there were times na hindi siya nakaka-attend ng klase because there were days na inaatake nga siya ng lupus niya. So she had to go to the hospital, she had to go had the checkup. Now, ang possible cause ng lupus niya was stress. Kasi nagka-lupus lang siya around at the age of 21. Parang nung nag-third year ata siya or nag-second year siya, dun siya nagka-lupus. So it could be environmental as well due to exposure to UV light, gender, infection, possible infection, exposure, Epstein-Barr virus, and other causes. So there would be an abnormal immune response. So here's your antigen. They could be presented by dendritic cells. Then the dendritic cells would become an APC, presenting it to the B cell or the T cell. Now, the B cells would form autoantibodies that would attack immune complexes. Then the T cells would also cause activation of the complement pathway. And if the complement pathway is activated, there could be inflammation. And worst case class, it could affect the kidneys. How does it affect the kidneys class? It would cause too much increase immune complexes in the blood. So madaming immune complexes sa blood, 'di ba remember ang antibodies nyo are proteins. If there are too much proteins, gamma globulins passing to the kidney, it could cause inflammation or nephrotic syndrome or glomerulonephritis. So there would be rashes, nephritis, arthritis, leukopenia, central nervous system diagnosis, carditis, clotting, etc., leading to kidney damage. And ang pinaka-worst niya class, there would be blood vessel damage, especially the heart. So there would be renal failure, atherosclerosis, palm fibrosis, stroke, damage from reactions, and others. So this is the different possible genes for lupus class. So you have your C1Q, C2, C4, HLA-D, 2, 38, MBL, FCR2A, 3A, 2B, interleukin 2. So you would have susceptible genes for the following. This causes an increased risk for lupus plus the presence of environmental triggers. So ano yung pinaka most common na environmental trigger nyo class is your UV light exposure. And there's also a possibility if you're female class, mas common sa inyo ang lupus. Napaka ano pala nito, no? Gender discrimination. So if you're female, you tend to have higher risk of developing lupus. Then if you were exposed with Epstein-Barr, that's the most commonly implicated disease. Now, leads to abnormal immune response that would trigger your dendritic cells, T cells, B cells, forming autoantibodies and immune complexes that will deposit in parts of the body that would cause inflammation in the form of a rash, nephritis if the kidneys are involved, arthritis, leukopenia, pericarditis, even your clotting factors could be involved. Ang worst case nito class, there would be prolonged. So most of the time, ang mga may lupus class sa kanilang clotting tests, they would have a prolonged PT and APT. If not corrected class, this would lead to chronic inflammation, causing damage. You will have renal failure, atherosclerosis, pulmonary fibrosis, and even worst case, stroke. So risk factors, genetic susceptibility, so ito yung mga genes affected. Environmental factors would include stress, drugs, UV light, and even infection. And another autoimmune disease is yung for SLE as well, class, is that for you to be actually positive for this, 4 out of 11 of the symptoms must be present. So, ang pinaka-common na symptom for lupus is yung butterfly rash or your malar butterfly rash. So, these are usually found on the nasolabial fold. So, ito yung ilong nyo. Dito banda. Yan, basta sa ilong nyo yan. Nasa nasolabial folds. And it would extend up to the cheeks. Then there would be discoid rash, raised erythematous patches with chlorotic scaling, photosensitivity, oral ulcers that are usually painless, seen in hard and soft palate, and buccal mucosa. So sa bibig class, there would be painless ulcers and uh, typically in the hard, so yung sa taas ng mouth natin, and even in the soft palate, so sa likod. Then arthritis, non-erosive arthritis involving 2 or more peripheral joints, serositis, renal dysfunction, neurologic dysfunction, especially seizures class and psychosis. Hematological, there would be anemia, leukopenia, thrombocytopenia, lymphopenia. Basically, you have a case of pancytopenia. Di ba pag sinabi mong pancytopenia, you have You have a decrease, PANCYTO, class, pancytopenia. You would have decrease the all cells, basically all hematological cells are decreased. Then immunologically positive for your LE cell preparation or anti-DNA antibody or anti-SIM antibody. Then the best immunological test class is yung positive siya for ANA. So I want you to memorize this different pictures class. This is the one usually asked in the board exam, as in the ASCPI. So each would have different patterns. So let's tackle them. Let's try to tackle them in a fast. So this would be the ANA results. So this is the best screening test. For ANA class, there are different antibodies. So we have your anti-DS DNA or anti-double-stranded DNA, highly specific for SLE, correlated with renal disease. Anti-SM, specific for SLE. So kung positive ka na dito class sa dalawang to, sure na yung case nyo na may SLE ka. Then there's also high anti-RNP, high titers associated with syndromes with overlap features of several rheumatic syndrome. So pwede siyang related sa rheumatic disease. And then anti-RO, SSA, not specific for lupus, associated with your Zika syndrome, subacute cutaneous lupus, neonatal lupus with congenital heart, heart block. Then your anti-LA, SSB associated with anti-RO, low prevalence of renal disease. Antihistone, drug-induced SLE, specifically the drugs hydralazine and procainamide. Then antiphospholipid directed against phospholipid binding plasma protein, most commonly B2 glycoprotein, associated with thrombosis, recurrent fetal loss, thrombocytopenia, hemolytic anemia. So take note of that. And then here are the different patterns class. So we have your peripheral or your rim pattern, your homogeneous or your diffuse, your speckled, your centromere, your nucleolar. Then an ANA patterns with anti-DNA not seen on HEP2 would be SLE, anti-DNA, antihistone, anti-DNP. It could be rheumatoid arthritis or SLE. Then anti-SM, RNP, anti-RO, LA, anti-Jo1 and MI2, anti-SCI1. So this could be related with lupus, Sjogren syndrome, PMDM, PSS. Then anti-centromere, it could be your PSS or your CRESS. And then antinucleolar, SLEN, PSS. So kindly memorize this class. This may come out in your exam. So these are the different drugs for lupus. So anchor drugs for lupus would include hydroxychloroquine. Anchor drug for rheumatoid arthritis is your methotrexate. Hydrochloroquine class is the drug of choice for lupus. Methotrexate is the drug of choice for RA. Now, the blue fonts, itong nandito sa right side, these are medications which are responsible for drug-induced lupus. So this drugs class, if you're taking them, they can cause lupus. So for the sake of time, kindly memorize them or read them on your own. No? Let's go to the another one, your rheumatoid arthritis. So RA class can be characterized as chronic, symmetric, and erosive arthritis of the peripheral joints that could affect multiple organs such as the heart and the lungs. In addition to a decline in functional ability, there is a reduced life expectancy. Strongest association would appear within certain DR4 alleles class. This would occur in 70% of patients with RA. Diagnosis of RA is based on the 1987 criteria established by the American College of Rheumatology. So, meron siyang criteria class. Ito siya. So, this is the criteria to know if you are positive for rheumatoid arthritis. So, there would be morning stiffness for 6 weeks, arthritis of 3 or more joint areas for 6 weeks, arthritis of hand joints for 6 weeks, symmetrical arthritis for 6 weeks, rheumatoid nodules, serum rheumatoid factor positive, and radiographic changes. So there are different definition. Kindly memorize them. So macrophages and neutrophils are attracted to the area, and this would result in the formation of an organized mass of cells called a panus. Itong panus na class would grow in the joint space and would invade the cartilage. Pro-inflammatory cytokines found in synovial fluid would contribute to inflammation, such as your interleukin 1, interleukin 6, interleukin 8, interleukin 15, interleukin 18, and tumor necrosis factor alpha. Tumor necrosis factor alpha plays a key role in the inflammatory process by inducing continual secretion of interleukin 1, 6, and 8. In addition, tumor necrosis factor alpha facilitates the transport of white blood cells to the affected areas. Collagenase and other tissue degrading enzymes are also released from synoviocytes and chondrocytes that line the joint cavity. The end result is the destruction of connective tissue, cartilage, and bone. Now, it is not known class what role autoantibody plays in the initiation of the inflammatory response. Approximately 75% of patients with RA have an antibody that has been called the rheumatoid factor. So this is an IgM. If you still remember class, ito ay isang IgM. Rheumatoid factor is an IgM that attacks the Fc portion of the IgG. So in rheumatoid arthritis, IgM antibodies combine with IgG, and these immune complexes become deposited in the joints, resulting in a type 3 reaction class. Death of granulocytes and macrophages trigger production of citrulinated proteins, and overexpression of these antigens may provoke an immune response. This family of antibodies is detected using your cyclic citrulinated peptide. Hence, the antibodies class are called anti-CCP. Anti-CCP is now the lead marker class for detection of RA because it is much more specific than rheumatoid factor. So take note of that class. The new leading marker for RA is your anti-CCP or your anti-citrulinated peptide antibodies. So these are the different treatment for rheumatoid arthritis. We have your abatacept, your methotrexate. Your methotrexate class is considered as the first line CSD-MARD for the treatment of RA class. Then if you're familiar with chloroquine and hydroxychloroquine, this is related to your malaria. So these are anti-malarials class approved for RA. But they are not very effective against DMARDs. Excuse me. So they have different adverse effects. Kindly read on them and memorize. They may come out in your exam. Then we have your tocilizumab, binds to soluble and membrane-bound interleukin 6 receptors and inhibits the interleukin 6 mediated signaling via these receptors. Interleukin 6 is a pro-inflammatory cytokine produced by different cell types, including T cell, B cells, monocytes, fibroblasts, synovial, and endothelial cell. So do memorize this class. This may come out in your exam. And under addendum, tocilizumab is the only monoclonal antibody that is FDA approved for the treatment of COVID-19 infection. Remdesivir, on the other hand, is antiviral in nature. Then another one, Graves' disease class. So sa Graves' disease, I will not go much on it, but the thing you need to remember here, class, is that your TSH antibodies would attack uh, the thyroid gland, causing excessive production of T3 and T4. Then we have your Hashimoto's thyroiditis or hypothyroidism, wherein the thyroid would show hyperplasia with an increased number of lymphocytes. Cellular types present included activated T and B cell, macrophages, and plasma cell. The immune response would result in the development of germinal centers that almost completely replace the normal glandular architecture of the thyroid and progressively destroys the thyroid gland. So in Hashimoto's class, there is too much T cell, there is too much B cell in the body. Now what happens is that these two would infiltrate These two would infiltrate the thyroid and they would start destroying the thyroid glands, causing hypothyroidism. Decrease T3, decrease T4. Antibodies to thyroglobulin would predominate, progressively destroying thyroglobulin and producing symptoms associated with hypothyroidism. So that ends class our module 11. Congratulations for finishing IS Immunocero.